Long-term effects of radiation. No one knew the full effects of radiation exposure on the human body after an atomic blast. Broken bones mend, severe cuts and burns can eventually heal, but exposure to full-body radiation affects the body for a lifetime. Radioactive waves penetrate the skin, moving into the bones and bloodstream and into the body's cells. Inside the nucleus of a cell is deoxyribonucleic acid, DNA, which is a cell's carrier of genetic information. Radiation damages DNA. Cells may then reproduce abnormally, later leading to cancer and other diseases. After the atomic bombings in Japan, children who had been exposed to the radiation were particularly vulnerable to certain cancers. For example, Hibakusha, who had been 3/4 of a mile from the epicenter, had a 40 to 50% chance of developing one of several types of cancer. A child survivor younger than 10 years old who was 1 mile from the epicenter had an 18% higher risk of a leukemia diagnosis than did people who had not been exposed to the radiation. Doctors also noted a marked increase in rates of thyroid cancer, specifically in those who were children at the time of the blast. In 1946, President Truman ordered the establishment of the Atomic Bomb Casualty Commission, ABCC. The goal of the commission was for American doctors to go to Japan to observe and track the lifelong effects of radiation on atomic bomb survivors. Along with Japanese physicians, the American doctors examined survivors, asked questions about their atomic bomb experiences, calculated the distance they were from the epicenter, and charted medical observations. Over the years, ABCC doctors documented the thick, itchy, and painful keloids that had healed over the thermal burns of the Hibakusha. Keloids cover the back of a survivor of the Nagasaki atomic bomb. Keloids are dense, fibrous growths that grow over scar tissue. They observed cataracts and damaged eyes and noted birth defects in the children born in the months after the bombing. And they diagnosed cancers: skin cancer, lung cancer, stomach cancer, breast cancer, liver cancer, thyroid cancer, and leukemia. Under ABCC rules, American physicians were not permitted to share their growing database of clinical knowledge with Japanese physicians, nor were ABCC doctors allowed to treat their patients' illnesses. They were there simply to collect information. Hibakusha felt deep distrust of American ABCC doctors. With no offers of medical treatment, many Hibakusha felt the ABCC had reduced them to numbers on a chart rather than people in need of help. Doctors wondered how long it would take to fully understand the long-term effects of radiation on the human body. Dr. James Yamazaki, the third director of Nagasaki's ABCC program and a Japanese-American citizen, summarized the situation. We must wait until the end of the normal lifespan of the youngest survivor before we can know the full story of the effects on those exposed to the radiation of the bomb. No one can say how much longer it might take for defects to show up in succeeding generations. James Yamazaki spent his long medical career studying the impact of nuclear explosions and radiation on children. After his work in Nagasaki, Yamazaki studied the effects of radiation from nuclear testing on children of the Marshall Islands. He has become an anti-war activist and an advocate for the elimination of nuclear weapons.